The mahogany boardroom table gleamed under fluorescent lights as Dad adjusted his tie, preparing to present quarterly surgical statistics to Riverside Medical Center's board of directors, the same hospital where my emergency brain tumor removal had been scheduled for Thursday morning while my parents planned their Tuscany vacation. "Our family has always prioritized resilience over medical drama," Dad announced to his assembled colleagues, his voice carrying the authority of someone who'd spent 20 years as Chief of Cardiology. "My daughter's recent health complaints are a perfect example of how some people catastrophize minor issues. Minor issues. The 3.2 centimeter meningioma pressing against my frontal lobe, causing seizures that had progressively worsened over 6 months while my parents attributed them to graduate school stress and inadequate sleep habits. Emma's always been prone to anxiety," Mom added from her position as Director of Medical Affairs, her voice carrying that familiar tone of maternal concern disguised as professional assessment. "These headaches she's been having are clearly tension-related. Tension-related headaches." That had led Dr. Sarah Chin at Johns Hopkins to identify the brain tumor requiring immediate surgical removal. The same Dr. Chin who'd been trying to contact my parents about surgical consent forms they'd been ignoring for 3 weeks. "The problem with today's young adults," Dr. Patricia Wilson observed, consulting her notes about healthcare resource allocation, "is they seek medical explanations for normal life stressors. Normal life stressors. Like the partial seizures that had begun affecting my motor control, causing hand tremors that made typing nearly impossible and balance issues that had resulted in 2 falls down my apartment stairs. Emma insists she needs some kind of brain surgery," Dad continued, his voice taking on that particular exasperation doctors reserve for difficult patients. "Complete overreaction to what's probably just migraines. Brain surgery. Scheduled for 7 a.m. Thursday morning, to be performed by the same neurosurgical team that had consulted on several of Dad's cardiac patients." The irony of his professional relationships extending to the surgeon whose expertise he was publicly dismissing felt particularly sharp. "We've decided not to enable this attention-seeking behavior," Mom declared to the assembled medical professionals, apparently unaware that her dismissive attitude was about to become the subject of professional ethics review. "Sometimes tough love is better medicine than unnecessary procedures." Unnecessary procedures. Like the craniotomy that 3 independent neurosurgeons had deemed critical after reviewing MRI scans showing the tumor's proximity to areas controlling speech and motor function. "Emma's been doctor shopping," Dad explained to colleagues who might question his daughter's medical situation. "When one physician doesn't give her the dramatic diagnosis she wants, she finds another one. Doctor shopping." Between Johns Hopkins, where I'd been recruited as a research participant for their brain tumor registry, Massachusetts General, where I'd consulted with their neurosurgical oncology team, and Mayo Clinic, where specialists had confirmed the urgent need for surgical intervention. "The vacation timing isn't our fault," Mom added defensively, apparently anticipating criticism about their travel plans. "We booked Tuscany months ago, and Emma scheduled her supposed surgery to conflict deliberately." Deliberately. The tumor's growth rate had accelerated according to serial imaging, requiring surgical scheduling based on medical urgency rather than family vacation preferences. But explaining tumor biology to parents convinced of my manipulative tendencies seemed futile. The board meeting continued with discussions about healthcare resource management, each comment revealing the depth of my parents' professional blind spots regarding their own daughter's medical crisis. "Dr. Harrison's approach to family medical situations demonstrates excellent clinical judgment," the hospital administrator noted, apparently using Dad's handling of my case as a positive example. "He's avoided unnecessary resource allocation for questionable presentations." Questionable presentations. While the tumor continued growing at measurable rates documented through monthly imaging studies that my parents had refused to review, despite having access to the hospital's radiology systems. "We see this pattern frequently," Dr. Wilson added, warming to her analysis of healthcare utilization patterns. "Young adults seeking medical attention for problems that resolve with lifestyle modifications." Lifestyle modifications. Like the anti-seizure medication I'd been prescribed to manage symptoms while awaiting surgical scheduling. Medication my parents assumed I was taking for anxiety rather than epileptic episodes caused by tumor pressure. "Dr. Harrison's daughter represents a classic case," Mom continued, apparently comfortable using my medical situation as educational material. Somatization of graduate school stress manifesting as neurological complaints. Neurological complaints that had been documented through continuous EEG monitoring showing abnormal electrical activity consistent with focal seizures originating from the tumor's location in my frontal cortex. The key insight Dr. Harrison provides, the chief medical officer observed, is recognizing when family members attempt to manipulate medical resources through dramatic symptom presentations. Dramatic symptom presentations, like the tonic-clonic seizure I'd experienced in the hospital parking lot 3 weeks ago. An episode that had been witnessed by 2 emergency department nurses who'd recommended immediate neurological consultation. Emma's timing is particularly suspicious, Dad continued, building his case for my medical deception. These supposed symptoms always worsen right before important family events. Important family events, like the medical conference where Dad was scheduled to present research on cardiac surgical outcomes. Research that would seem less impressive when colleagues learned he'd missed his daughter's brain tumor diagnosis entirely. We've learned not to enable hypochondriac behavior, Mom declared with the conviction of someone who'd spent years in healthcare administration. Sometimes the kindest thing is refusing to participate in medical theater. Medical theater. While my tumor continued compressing healthy brain tissue, causing progressive symptoms that would worsen without surgical intervention scheduled for the same week they'd be touring Italian vineyards. The neurosurgeon Emma found is probably just after surgical fees, Dad suggested, apparently having developed conspiracy theories about medical professionals whose expertise exceeded his own. These young doctors will operate on anything. Young doctors. Dr. Chin had 15 years of experience in neurosurgical oncology and had published over 60 research papers on brain tumor management. Her expertise in meningioma removal exceeded that of most neurosurgeons worldwide. Emma needs psychiatric evaluation, not surgery, Mom concluded, her voice carrying that finality healthcare administrators use when closing difficult cases. Address the underlying psychological issues instead of enabling surgical fantasies. The revelation came when Dr. Sarah Chin, chief of neurosurgery at Johns Hopkins, entered the boardroom flanked by 2 medical colleagues and carrying imaging studies that would transform the meeting permanently. Dr. Harrison, she announced, her voice cutting through administrative discussions like a surgical laser, we need to discuss your daughter's emergency brain surgery immediately. The boardroom fell silent except for the soft humming of projection equipment being activated by technicians who'd apparently been summoned for an impromptu medical presentation. Dad's quarterly report froze mid-sentence, his laser pointer suspended in space like a weapon that had suddenly become useless. According to Johns Hopkins records, Dr. Chin continued, consulting her tablet with the authority of someone who'd reviewed the case comprehensively, Emma Harrison requires immediate surgical intervention for a rapidly growing meningioma. The projection screen illuminated with brain scans showing unmistakable evidence of tumor growth, each image labeled with dates corresponding to my parents' dismissive comments about minor headaches. These MRI sequences, Dr. Chin explained to the assembled medical professionals, demonstrate a 3.2 centimeter tumor compressing frontal lobe structures, causing seizures that will progress to status epilepticus without immediate surgical removal. Mom's face had gone completely pale, her administrative confidence evaporating as clinical reality invaded her boardroom. Dr. Harrison, Dr. Chin said, turning to Dad directly, your daughter has been trying to contact you about surgical consent for 3 weeks. The tumor's growth rate requires emergency intervention scheduled for Thursday morning. The documentation spread across the conference table revealed the scope of my medical situation. Surgical scheduling, anesthesia consultations, postoperative care plans, all requiring parental notification that had been systematically ignored. Emma's seizure activity, Dr. Chin continued, has been documented through continuous monitoring, showing progressive worsening that corresponds directly with tumor growth patterns. Uncle Stephen was staring at the brain scans as if they were evidence of an elaborate medical conspiracy rather than his niece's neurological emergency. The delay in treatment, Dr. Chin noted with the particular precision neurosurgeons use when discussing time-sensitive interventions, has already compromised optimal surgical outcomes. Further delay could result in permanent neurological damage. Dad found his voice first, though it emerged as barely more than a whisper. Emma. actually has a brain tumor? A meningioma requiring immediate surgical removal, Dr. Chen confirmed, apparently prepared to complete the educational transformation of the hospital's medical leadership. The aftermath unfolded with the systematic precision of a medical malpractice investigation. Dad's presentation on surgical excellence seemed grotesquely ironic when colleagues learned he'd missed his own daughter's brain tumor diagnosis, attributing seizures to graduate school anxiety while tumor growth progressed toward life-threatening stages. Mom's administrative position underwent review when the hospital's ethics committee discovered she'd been using her daughter's medical crisis as an example of healthcare resource waste, despite having access to imaging studies that clearly showed surgical emergency. The Tuscany vacation was cancelled when my parents realized their daughter's brain surgery required family support rather than family absence, though their attendance felt more obligatory than supportive after months of medical gaslighting. My surgery proceeded successfully at Johns Hopkins, performed by Dr. Chen using techniques that preserved neurological function while achieving complete tumor removal. Recovery took place without family drama about my supposedly manipulative medical needs. The most satisfying moment came when the hospital's medical staff learned that the hypochondriac daughter they'd been hearing about had actually been fighting for appropriate medical care while her physician parents attributed brain tumor symptoms to psychological weakness. Dad called from the hospital parking lot, where he'd been sitting since learning about my surgical diagnosis. "Emma, I didn't understand that you were actually sick." His voice carried a humility that had been absent during months of medical dismissal. Through my recovery room windows, Baltimore stretched like a map of medical possibilities that extended far beyond family opinions about my character. "I was always sick," I replied quietly, reviewing post-surgical scans showing successful tumor removal. "You just preferred diagnosing my brain tumor as attention-seeking behavior." The silence stretched between us, heavy with months of dismissed seizures and delayed treatment that could have caused permanent neurological damage. Some lessons in medical humility couldn't be reversed through belated recognition or professional embarrassment, but they could prevent future diagnostic failures when family dynamics intersected with clinical judgment.